Hi everyone, my name is Dr. Meredith Byers. I'm a radiologist and I am one of the co-directors of Women's Imaging and Breast Health at our Barnes-Jewish St. Peter's Hospital and Progress West Hospital. What I wanted to talk with you about today is a little bit about what I do, what happens in a breast health and women's center, the importance of mammograms, and what the different kinds of mammograms are, a little bit about breast density and what that means, what screening recommendations are currently. There's a lot of controversy about that. And as well, the people in our department, such as our nurse navigator, what we do and how we can help you. So to get started, a women's center is an outpatient location. We're centered in both hospitals where we see women primarily for their screening mammograms. So what that means is that a woman comes in, she makes an appointment, and we do a traditional mammogram on her. That's for women who are having no current issues with breast health. It's part of their routine examination, much like you go to see your doctor or healthcare provider once a year and the other routine tests that you get. We do that examination, you leave, we create a report and we send it to you, and that report is generated and sent out within 24 hours of your study. You don't have to wait on us to do the report, but we do get it out to you pretty quickly. The other thing we do a lot of are what are called diagnostic mammograms, and that's a little bit different. A diagnostic mammogram means there's a problem. Either you've noticed something, your physician or healthcare provider has noticed something, or you have a history of something. And those somethings can be anything from breast pain to feeling a lump to problems with breastfeeding to a family history of breast cancer. All of those are reasons to have a diagnostic mammogram. Also, if you've had breast cancer, we'll follow you up with a diagnostic mammogram. And that study is a little bit different in a couple of ways. Number one, we ask that you make an appointment for it. It's done when the radiologist is present, so she or he can interpret your images on the spot. We do the traditional views that we do for a regular mammogram, but we also do some extra pictures, and we explain to you before we do those what they are and why we're doing them. Then we take those pictures and I review them, see if we need any additional information, and I may decide that the pictures are great and we're all done, or that we might need a breast ultrasound, or potentially a breast MRI, or even a biopsy. So I then come in and talk with you about what needs to happen next. You get your results on the spot, so you leave our center with that information. You know exactly what's happening and what needs to happen next, and your doctor gets the results at the same time. So that's mainly what we do. A couple of other things we do in addition are breast ultrasound. We talked about that a little bit. Breast MRIs is another way for us to look at your breasts. We do pelvic ultrasounds. We do bone densitometry or exams to assess your bone density. And we do a lot of procedures. So when you come in the Women's Center, there's a chance you might see me and talk with me. There's also a chance that your study will be a routine one and you'll just go home after that. Lately, one of the big items in breast imaging, and really one of the most exciting things to happen in our field, is three-dimensional or 3D imaging. The fancy name is digital breast tomosynthesis. What that is, if you're somebody who's had a mammogram in the last decade, you're aware that you usually come in and we take 2 pictures of each breast, 1 in each plane. So it's 4 pictures and then you're done. I describe that to people that my job is then to look at your pictures, and it's kind of like I'm standing on the outside of a forest. I'm looking into that forest filled with trees, and I'm trying to pick out the one tree that has something wrong with it. As you can imagine, that can be very challenging. What three-dimensional or tomosynthesis has added to it is that when we take a picture of your breast, we actually take 60 to 100 slices of images. So rather than getting 1 picture, I now look at up to 100 pictures instead of that 1. So for a regular exam, instead of doing 4 pictures, I might look at up to 400 pictures. And the way I describe that to my patients is that now, instead of standing at the edge of that forest and looking in, I'm actually walking through that forest. And I get to walk up to each tree and take a close look at it and then decide if there's anything wrong. So that has been a great advent in technology. We are the leaders in St. Charles County in three-dimensional imaging. We've been doing it the longest. We have the most experience with it. We have the most specific technology to do it. So we feel very confident with it, and we're really happy that we can offer it to our patients. For our patients, when you come for your mammogram, we will ask you if you want to have a three-dimensional study. You have the option to say no. We encourage you to say yes because it's just that much more information that we can obtain from your exam, and it helps you and us in a couple of ways. It allows us to see things more clearly. It allows us to decide if something is real or not. Often we call women back from their screening mammogram because we think we see something but we're unsure. This really helps us know if we see something for sure or not. It also really helps with women who have dense breast tissue. It allows us to basically see through that forest that is just packed with trees for me to be able to see those individual trees or individual lesions in there. So it's helpful in a couple of ways. We offer it to all of our patients. As I said, you can always say no, but we encourage you to say yes. More and more insurance companies are paying for it. If they don't, we do offer an out-of-pocket cost, which we'll explain to you. And really, given the amount of information it provides and the amount of security it gives you in knowing your exam has been as fully performed as possible, I think it's worth it. So that's what we do on a day-to-day basis. One of the other things that we're able to offer our patients is that we have a nurse navigator. And I do get questions from patients about what a nurse navigator is and how she or he operates. We have a woman named Jan Gardner. She's been our nurse navigator for the last several years, and she's an amazing asset to our department. What a nurse navigator does is that they serve as a connection. They are a connecting piece in the healthcare puzzle. I know many patients, when they have something wrong with their breast or they have a concern, first you don't know what to do, and then you become really worried, and it's really helpful to have somebody who can guide you through that process. So what Jan does is that for any patient that comes in for a diagnostic mammogram on whom we recommend a procedure or an additional exam, she comes in and talks to that patient. She explains to them exactly what this means and what we're doing. If we move to having a procedure done, then she'll explain to the patient exactly what that procedure is, what it's like, show them the equipment so that they're familiar with what's going to happen. She then becomes the primary contact for the patient after an exam or a procedure. So you have her phone number. You can call her with any questions and she will answer or return your call. And she'll check on you in the days following your exam or your procedure so that you know what's going on. She's then a connector between the patient and your physician. She is the one who reaches out to your physician to give results, to see if there's anything else that we can provide, to make sure that you and your physician have all of the information. And then finally, she's the person who helps you if you need subsequent care. Many of our patients, after coming to us, may need to see a breast surgeon or another type of specialist, and Jan is the one who facilitates that appointment and makes sure that they know who you are and you know who they are. So we're really fortunate to be able to offer her services. She's with us every day of the week, and she works at both the Barnes Jewish St. Peter's and Progress West Hospital campuses. And if you're ever in our department, we always encourage you, if you have a question, to let us know, because she's happy to take some time to sit down with you and answer those questions. So we really are fortunate to have a nurse navigator in our Breast Health and Women's Center. We have wonderful technologists in there as well. We have a great staff. We'd love you to come see us. If you're interested in making an appointment for your mammogram, or if you have a breast concern, or even if you just have a question, I encourage you to reach out to us, and there are a couple of ways to reach us. You can visit our hospital website. You can also contact the phone number on the screen. We're there both to help you schedule an exam, as well as to answer any questions or to give you information that you need. Thanks, everyone. I really appreciate your time today.